We are the neurology team at the University Teaching Hospital in Lusaka, Zambia, and this is our submission for the Global Brain Health Changemaker Challenge. Stroke is the second leading cause of death and disability worldwide, and its burden is greatest in low and low-middle income countries. Zambia is a southern African country of more than 20 million, where stroke is the fourth leading cause of death and in-hospital stroke mortality is 24%. Stroke units are effective interventions to improve stroke outcomes but are largely absent in sub-Saharan Africa. In response to the IGAP pillar of providing effective, timely and responsive diagnosis, treatment and care, the Zambia neurology team set about to develop the country's first stroke unit. A one-day workshop with all stakeholders, including physicians, nurses, therapists, and nutritionists, was held to systematically adapt international clinical practical guidelines using an evidence-based approach and local contextualization to develop a formal protocol for a stroke unit at the University Teaching Hospital in Lusaka. The first Zambian stroke nurses were trained in core skills including aspiration prevention, swallow screening and mobilization, and on the 1st of October 2023 the stroke unit launched.
Our idea links to the Global Health Clinical Exchange session on building capacity in global neurology. We wanted to create a model for translating evidence to improve local care that could easily be further adapted in different parts of the country and in the whole region, including the unique approach of involving family caregivers in the process.
The innovation of our approach lies in contextualizing established methods in acute stroke care in order to apply them to a novel setting and population while including real-time patient and caregiver perspectives. Formal clinical practice guideline adaptation processes have been limited in low and middle income countries, with very few focusing on acute stroke care.
We developed a modified real swallow protocol to fit our local setting, and we are taught how to screen for dysphagia in our patients. The stroke unit was provided with locally made foam wedges, that was we call them, that are placed behind the patient's mattress in order to prop them up to about 45 degrees and prevent aspiration. We specifically focus on teaching family caregivers mobilization and appropriate feeding and nutrition as they stay at their patients' bedsides 24/7.
Our post-implementation data so far have shown a significant reduction in in-hospital stroke mortality from 24 to 10%, mainly due to preventing aspiration pneumonia and improving mobilization. This is not only impacting the individual and their families, but also the healthcare system and, eventually, the economy of the country. Our goal is to serve as a model for stroke units around the country and the region, as well as improve awareness, recognition and education around stroke in the community in order to pave the way for acute stroke treatment options such as thrombolysis and endovascular therapy. In April this year, our team conducted formal training for stroke nurses at Levi Mwanawasa Teaching Hospital, the second largest public hospital in the country, which has led to the implementation of the country's second stroke unit. A third one will follow at Ndola Teaching Hospital in July 2024. We hope it will continue to spread nationwide so that all Zambians with stroke can benefit.
In our setting, resources are very limited in terms of time, tools and staff. This has meant that we've had to be very creative to deliver standardized stroke care to our patients. This has been enabled by the fact that we are a multidisciplinary team and we've been able to see the immediate benefits to our patients.
Becoming Zambia's first stroke nurses has empowered us, provided us with new skills and new knowledge. We started out as trainees, have gained expertise in managing stroke patients, and have become trainers to aspiring stroke nurses around the country. We are proud that our work is getting nationwide recognition, as we're invited to speak on research conferences as well as inform the community on radio shows and TV shows.